Right. And as the country awaits President Uhuru Kenyatta's announcement tomorrow on whether to reopen or not, the big question is, if we do, how do we do that strategically and responsibly to avoid a surge in cases? Well, joining us now from Spain is a Kenyan doctor, Dr. Sally Kuria. She's been monitoring the situation here in Kenya, but also give us insights from how it is in Spain that actually leads in terms of cases in the EU. Dr. Sally, from what you've seen, what is the way forward for Kenya? We're waiting for that big announcement from the president. There are a lot of concerns on how to do this. Of course, the livelihoods have been hit really hard here in Kenya. But from where you sit, you've seen the hardest hit areas in Spain. We just heard 70,000 people had to be locked down again in the country. So when talking about reopening, what's the best way forward?
So when we're talking about, good afternoon, Victoria, and good afternoon, Jeff. Thank you for having me. So it's a very important, it's a very interesting question. Let me start by saying when the pandemic hit both Spain and Italy, the speed at which the pandemic was seeded in Madrid was very, very fast. So the timing for carrying out mitigation was a lot slower. Between when the pandemic got to Italy and Spain, very little was known about the disease, the modes of transmission, masks, not masks. It was not very clear. So the lockdown came purely because there was a lot of fear all at one go. The best way, with this said, to open up is to balance the reduction of cases that we are receiving, which is a clear sign that community infection is going down, to count the reduction and evaluate the reduction of people with influenza-like symptoms coming to the hospital, to ensure that your medical staff has very robust bedding facilities, ICUs, and personal protective equipment. So these are the three main factors we have used in Spain to make those hard decisions. They are economic decisions, and any leader will get it wrong because there is no expert and there's no way forward. You must just try. So that would be my answer.
Dr. Sally, your colleagues here in Kenya are watching you right now. And as a Kenyan doctor in Spain, one of the hardest hit countries in Europe with what, close to 30,000 deaths right now? Tell us.
Slightly more.
Yeah, give us a perspective, doctor. What has it been like there in Spain during this pandemic?
There was a drastic change of behavior and lifestyle. In Spain, the country is homogeneous, so people speak the same language. Many people have relatives in different parts of the country. So Madrid was very hardly hit. In a very short time, from a large number of infections, we had a sequential large number of deaths. So most people I know now in Madrid have friends, relatives, uncles, and partners who have passed on, and there are children who have been orphaned. So psychologically, that was a huge blow to the country. But the reason why the draconian lockdown actually worked was fear. Deaths came fast. Death came unexpectedly. And the feeling among medical personnel was, what is this? Basically, in med school, we are not taught to deal with death. We are taught to deal with life. We tend to cure and heal because we tend to see life moving on. We are not used to deal with death. And there was a lot of death. Therapies weren't working. And it was a huge blow to a lot of the medical staff here, especially when we started having medical casualties. So there is a huge component to healthcare workers and how they live every single day, watching the deaths were inevitable and they were totally unpredictable.
And Dr. Sally, you mentioned, the deaths came quick, they came fast and in huge numbers, a case that we're not necessarily seeing across the continent. And though you see experts saying that we're not out of the woods just yet. And when we're talking about vulnerable groups, it's very different from vulnerable groups in Europe and the US as well. When we're talking about who is at risk here in Africa, in Kenya, who should be sheltered if we're to talk about reopening and to ensure that those groups are not affected should cases surge?
So there's been a narrative that's gone round about COVID-19 that the elderly are the mostly affected. Now, from a medical point of view, this is true. So it is true that we have very selected categories in the European and the Germans, for example, in the entire European setting, certain categories have been identified: diabetics, hypertensives, obese people, and the elderly. But we must understand that our model is not the same as the European model. Our life expectancy is 63 years, whereas in Spain, Italy, and Germany is 83. So our youth, our median age is 19 years old. So one very important thing that I feel we should start by saying, even if it's very common and said around, is vulnerable groups. Why? Because everybody is vulnerable to COVID-19. What the disease does with every population, it will have a different pattern of fatalities according to the people it finds. So let me explain that. In Italy and Spain, the elderly were present in the population in larger numbers. So 80% of people beyond 80 years old were succumbed to the disease. And 0.1% of 10 to 19-year-olds succumbed to the disease. Now, why is it important for us to know that in Kenya, this might not be the case? Because the percentages in statistics are determined by the global number of infections. So if 1 million people get infected, that 0.1% of age groups from 10 to 19 will become a larger number. So that will be 10,000 young people. So it's very important to understand that vulnerable groups, when we are in the state of a pandemic, is basically everybody. Because in Spain, we had patients who are 100 years walking out of the ICU and patients who are 18 with no prior disease succumbing to the disease. But it is true from a medical point of view, diabetics, obese, hypertensive, and yes, the elderly, which in our community will be 50, 60, those are our elderly, will succumb easier. They will get a more serious disease. So why is this very important to understand? It's important to understand so that if you are 45, 46, 50, you're going towards, you will most probably have a more severe disease, because the more infected people there are, the more the statistic number will simply shift to a lower age group. So when it comes to this category in our country, we must be able to inform those age groups that they must not leave the house if they can work from home. They must make sure that they walk into a place without people wearing mouth coverings. They must not be there, because the probability of contracting the disease and rapidly moving towards ICU is quite high. And these are the people we must protect. So to give an example, a border driver who is 50 years old must get a barrier to prevent him from being in contact, a plastic barrier to be in contact from his passengers, because the probability of this person getting a worse disease will be equiparable to the 8-year-olds that we had in Spain and Italy.
Dr. Sally, real quick, our top health officials here in Kenya have been warning that the worst is yet to come. Your thoughts?
That is probably correct. That is probably correct. So as we said before, there were 3 vital and very important reasons why the Africa pandemic and the pandemic in Kenya was much slower. Firstly, the air traffic in February was a lot lower than the rest of the world. So less than 2% of air traffic in February was flights coming in and out of Africa. That was the traffic that happens in Africa in that period, which means seeding of the disease, we all know the disease was coming from Europe, was a lot less. Secondly, as we've said before, our age group, our median age are 19-year-olds, which simply means that what we have is a huge group of asymptomatic transmitters. So we can be defined as a country with high numbers of asymptomatic patients. So let's remember that COVID-19 became a pandemic only because they are asymptomatic carriers. If we all knew that once someone has fever or is coughing, stay away and isolate them, we wouldn't be in this condition. But having those young adults who are symptomatic carriers, that is the reason why we are where we are right now. And the last reason why Africa and Kenya had, we managed to flatten the curve earlier was the mitigation measures that we were congratulated, even in the first world, we were congratulated on the speed at which we managed to carry out the mitigation measures. Now, why are we in a very dangerous spot? Because we have reached a point where economic factors will have to balance out with health factors, which then affect citizens' health, which then affect the economic situation of the country. So the worst is yet to come because a lot of awareness needs to be done, and we are only at the beginning of our pandemic.
Wow.
All right, great insights there. Thank you so much, Dr. Kuria, for your time. And a lot to think about from what she said. A country of super spreaders, but yet the worst is still to come.
Goodness. Dr. Sally Kuria there in Ibiza in Spain. Hope your family is watching and know that you're safe. Thank you for your time.
And thank you for having me.
All right, we're going to take a break here on Sunday Live. Coming up, plenty more ahead, including the second part of our story, investigative story, traveling up country and getting through.
That's right.
Wow.
Some new developments there coming up.
And plenty more as well. Keep tweeting at Koinange Jeff.
At Vicky Rubadiri.
At Citizen TV Kenya, the hashtag is Sunday Live.